Okay, this is Senate Health and Welfare, and we are back February 23rd. We have with us, before we get to the letters, Rosa, we're going to go to S206, which is a bill that we've been working on now for a while. And I think that we're ready to consider passing the vote to the full Senate. So why don't we begin with that one? We have it on our webpage. And I would entertain a motion on S206.
I move that we pass S206 draft 6.2. Is that the draft, Ruth?
Yep.
It is, except for I'm just looking at it. It has the yellow
Still has yellow in it.
markings on it still. So without Katie here, I'm gonna.
There she is.
Oh, good. We should ask
Yeah.
her. It'll probably be 6.3.
Yeah. Good catch. And that's why we take a minute. Katie, welcome. She's still getting on. Oh, there she is. Okay. We just we just decided to pass 206 first, and then we'll go to the letters with Rosa. So Senator Hardy noticed that the yellow is still in the draft that we have, and what will it be, a new draft number?
It won't. I'll just take out the highlighting and send a clean version to the reporter.
Okay, that's good. All right, so now Senator Hooker has made a motion that we vote favorably on S206 draft number 6.2. Discussion. Okay. Mr. Clerk.
Thank you, Senator Lyons. This time I'll call the roll for the vote on S206 version 6.2. Starting with myself, I'm a yes. Senator Cummings?
Yes.
Senator Hooker?
Yes.
Senator Hardy?
Yes.
And Senator Lyons?
Yes.
I have a vote of 5-0-0 to advance S206.
Excellent. And we'll have a clean copy, and the vote will go up with a reporter. And I'm thinking that who would like to report? I thought so.
I'd be happy to.
Yeah, no, I think that's a good idea, Ruth. You've worked very hard on this bill, and so that makes a lot of sense. Does that fit with it? Is everybody okay with? I'm not even going to ask if you're okay with that. It's okay.
Absolutely.
Good.
Thanks for
All
all
right.
your work, Ruth and Katie.
Yeah, Katie did a
Okay.
lot of work on this. Thank you.
So S206, that'll go up today, and then it'll be on notice tomorrow. Hopefully we can get through both the bills we've passed out this week before the town meeting week. All right, thank you, Katie. So now we're going to move to the letters that we have in front of us, and Rosa is here. Rosa, thank you for being here, and thank you for your work on this. Why don't let's pick up the letter to the congressional delegation first. You want to do that one first, or do you have a preference?
Nope, that works. Thank you again for having me. Just for the record, my name is Rosa Reyes, and I am a student clinician with the Office of Legislative Counsel. So the first letter we'll review will be the one to the congressional delegation. So that would be Representative Welch, Senator Leahy, and Senator Sanders. As you are aware, the pandemic has emphasized many needs for families that previously appeared less significant. The work of the Senate Committee on Health and Welfare has revealed cost barriers, and prohibit people from purchasing products to meet their basic needs. Products such as diapers, adult absorbent products, and menstrual products are essential in contributing to an individual's health and dignity. Currently, diapers, adult absorbent products, and menstrual products are not eligible for purchase using federal assistance programs, including Supplemental Nutrition Assistance Program, or SNAP, and Special Supplement Nutrition Program for Women, Infants, and Children. which is WIC benefits. While the committee understands that these programs focus on food and nutrition assistance, it seeks your assistance in advocating for addressing supplemental coverage of these essential products for SNAP and WIC participants. The committee understands that there may be relevant federal legislation pending before Congress this session, including HR 259 and Diaper Need Act of 2021, and urges you to support such measures. The committee asks you to continue your thoughtful attention to the basic needs of Vermonters by supporting this modest initiative. Thank you for your attention to the committee's concerns and for all that you do for Vermont. The committee looks forward to working with you on this and other important issues in the coming months.
Okay. Maybe we could take out that word committee in the parentheses there in the second line. I think that was one of my edits that doesn't fit. I didn't know I put the Senate committee twice.
No problem.
Okay. All right, we'll take it down. Committees, comments, edits, suggestions. Does it send the message that we were wanting to send? Okay. We all good with that? Rosa, thank you. Terrific. Do you need a stamp? No. Do you need a stamp to put on the envelope?
Oh, a stamp. Sorry, I'll go ahead and ask Katie that one because I'm not 100% sure if I do need one or not.
We're good. Okay. So this is good. We all approve that letter. I don't think we need to vote on this. We just all agree this works well. Is there anyone who disagrees with the decision to send it along to the congressional delegation? No, we're good. Okay, let's go to the next one, the Diaper Bank Stakeholders Letter Draft.
So this one is being sent to a variety of different organizations. So we have the Junior League of Champlain Family, the Vermont Food Bank, Department for Children and Families, Vermont Parent-Child Center Network, and the Building Bright Futures. This year, the Senate Committee on Health and Welfare Committee was referred S-198, an act relating to the Diaper Need Working Group. As its title implies, the bill proposes to establish a working group for the purpose of systemizing the distribution of diapers to families in need. The committee has heard testimony from both the Junior League, which is currently operating a volunteer-based diaper bank, and the Vermont Food Bank. While the committee does not believe a statutory working group is necessary to systemize the distribution of diapers in Vermont, it recognizes how essential diapers are to young families. I'm sorry, the train is passing. Just give me 1 second for it to completely pass.
It's better than jets.
Okay. So while the committee does not believe a statutory working group is necessary to systemize the distribution of diapers in Vermont, it recognizes how essential diapers are to young families and asks the recipients of this letter to come together on their own initiative to develop and implement a plan for statewide diaper distribution. According to the findings and testimony from S-198, the need for diapers has skyrocketed during the pandemic. In 2019, the JLCV Diaper Bank distributed 100,000 diapers in 3 counties, and over the past year has distributed more than 1.3 million diapers in 13 Vermont counties. There are 17,000 Vermonters under the 3 years of age, 24% of whom live in families earning between 100 and 200% of the federal poverty level. I think that's supposed to say poverty instead of property.
Yeah, I think you're right.
And may not be able to adequately afford diapers. Clean diapers are crucial for health and comfort of young children, and most childcare facilities also require that parents provide diapers for their child while at the facility. The current arrangement for distributing diapers to families in need through the JLCV Diaper Bank is not sustainable. The JLCV is a fully volunteer-run organization that does not have the staffing, infrastructure, or facilities to maintain a distribution system at the current level. The committee understands that other measures for supporting young families are necessary. It is also important to ensure that Vermont has a better system for diaper distribution. We hope that each of you will work together to build a better system for such distribution. John Sales of the Vermont Food Bank testified that he would be willing to call such a group together. The committee thanks the recipients of this letter for their myriad of efforts to assist Vermont families in need. Committee members welcome any recommendations for legislative action that the group may propose while developing a plan.
Okay. Good. So let's change property taxes to poverty. I do have just a question, a word in the last paragraph. Instead of saying you will work together, why don't we just say each of you will work together? I don't know whether that's grammatically accurate. So should it be that you will work cooperatively, something like that? Take out each. Just take out each, that you'll work together. Yeah.
Yeah, no, that makes sense.
And when I first read the draft with all the data in it, I thought that was overwhelming and too much, because people who we're sending it to already know this, but I think it enhances, it indicates what we've done, what we've heard, and then what the need is for them, for their continued work together. So I think it should stay in there. And I don't know if anybody else has comments on the letter. It looks good to me. Any comments?
I think it looks good.
We're good. Is there anyone who would not want to send this letter along? Did we hear from Morgan Crossman? I don't think Bright Futures came in on this one, but I think it might be a good addition, just to, because they deal with a statewide issues for kids, and we certainly have heard from them quite a bit in the past. Yeah.
So when I was proposing edits to Katie and Rosa for the letter, I actually called building Let's Grow Kids and asked them if they wanted to be on this, and they suggested that Building Bright Futures was more appropriate.
Yeah, good.
So they didn't think they needed to be on the letter, that Building Bright Futures was the better choice. So that's why.
No, I agree with you. I think it's a good addition. It's great. And Donna Bailey, who we know from previous work in the state, is here. So that's good. Okay, we're good with that letter as well then. Rosa, terrific. Thank you. This is great. And Katie will provide you with a stamp for this envelope.
Thank you.
All right, we're good. Okay, so that feels good to have those two things off our plates. And now we're left with S90, and we have some time. So Katie, here we are with S90. Where did you go? There you are.
Here. Didn't know S90 was coming up today. Let me
Okay. Well, we're going to have a conversation about what we heard in testimony. It's kind of loose testimony out there, and it's difficult to coalesce into something. But I think and we continue to hear from people. I don't know how many of you are getting emails from folks who are interested in the ALS registry, but I'm getting them left and right. Darn, you're not getting, I'm getting them from every part of the state. Maybe when I get them from your districts, I'll send them along to you. But the issue is that there's no, first of all, here's how I see it, and then we can talk about the bill. But this is a disease that acts really fast. So in order to put something in place that asks to find some kind of treatment or research on solutions to cover the disease is difficult. But having a registry helps to identify the people who are getting the disease, and perhaps would help with any epidemiological study that might go forward. But it's, people go on to the registry and then maybe 3 months or 4 months or 6 months later, they're no longer alive, which makes it really hard to do any kind of analysis. So I think that's kind of the driving, that's what's driving some of having the registry and having a involuntary or having a reporting that goes on within the state or regionally and then nationally. So let me just tell you what I'm thinking, and then you can tell, everybody can say what they're thinking. We heard that it might be possible to have a regional registry, and I think it might be a good idea to suggest to the DOH that we do that, have them address a regional registry, then some kind of mandatory report, I hate the word mandatory, but having some reporting that goes once the diagnosis is made to the state of Vermont. I don't think there's any, if you're going to have a regional registry, you have to have a local registry. And then having the information go to the national group. Beyond that, I don't know what folks are thinking. I really don't. So any thoughts here?
Well, I think Senator Lyons, you're on track here. I mean, it seems like it's going to be somewhat of a compromise to get something done here after watching. Although I was heartbroken to miss last Wednesday, but I did go back and watch the portions of it, and it seems like you're on the right track with what we could do.
Don't worry about the kids, Senator Terenzini. It's okay. If you have more to say, please go ahead.
No, that's it. I'm in a bit of a different spot this morning trying to do this. So and they're all here. So
and they're all feeling better.
Yeah, for the most part. But
okay.
No, I think Senator Lyons, you're right. I'd love to see something get done, and if it's at the regional level, then so be it.
Okay. Senator Hooker, go ahead.
So
Let's get
can
into
you remind me
discussion.
what the regional landscape looks like for this now? Who has the registry?
I think Massachusetts does, Katie. Is that
the only
right?
one, I think, in the area.
Yeah.
Yeah. Okay. And so when we talk about a regional registry, does somebody has to be designated as a kind of place to send all of the information?
That would be some of the work that would have to be sorted out with the states that are working on the registry. But regardless, we'd have to ask for ALS diagnosis to go to our Department of Health. Yeah. So,
And
so having that reporting process becomes important.
Okay. So right now, Massachusetts has a registry, but nobody else around us does. And so we would have to ask them to join in this. I mean, how would, what's the process in establishing the regional registry even?
I think it would have to be a Department of Health reaching out to Department of Health and sort of discussing the possibility of putting together a regional registry. The discussion may begin with Massachusetts. It could go to New Hampshire, Maine, New York. It would have to think about what we would be asking the Department of Health to do. They'd have to sort out all of the administrative issues once it started going forward. It wouldn't happen automatically. I mean, this would be more of a planning request.
But in the meantime,
yeah,
we would have to establish a registry first.
I think we'd have to get the data somehow, because that's the first step for Vermont, is to have some information about the cases that we do have in the state. We could, you could have a trigger for that. You could have it happen. It doesn't have to happen right away, but it could happen fairly soon.
Okay.
Go ahead. Just go ahead. Senator Hardy, then Senator Terenzini.
it seems, I mean, one of the things, a couple of the things that I heard was that, in Vermont, we have maybe 45 people at one time who have ALS. So from a perspective of doing any kind of viable research, that's not enough people. It's just not a significant enough a number of people. And any conclusions that could be drawn from 45 people would not be scientifically accurate. So there is a national registry, and I know it's a voluntary national registry, but that even if only, and I was trying to find out, they had told me what percentage, or told us what percentage people that they estimate, it's like 60%, I believe,
Right.
do the registry. But even that is more, and you can sort of gain some kind of scientific validity from those numbers. So what I was thinking, and I don't know, and we could check with one of the physicians who came in, or maybe some of when a diagnosis is made, if we could, we have done this in the past with other things, sort of require that a doctor provide information to a patient about one, encouraging the patient to register with the national registry and explaining how one does that. And two, provides information about resources available to patients and families impacted by ALS. So what are the services that are available, in terms of family support and patient resources? That may already happen, but I don't know. So that would be one thing.
Yeah.
And then the second thing is that because Massachusetts has a registry, and because apparently there's some efforts in New Hampshire, potentially maybe Maine, I think we heard that testimony. If we could direct the Department of Health to work with our regional departments of health, other departments of health in the region, and relevant, physicians and researchers to bring back a proposal or report to us about the possibility of creating a regional registry, that may first of all, connect us to our state and people in our state with other people who have ALS, but also provide much more that valid data. We're just so small that having our own individual registry, I just don't think makes sense. And I would also like to say, maybe a part of that proposal would be not just ALS, but all neurodegenerative diseases, and sort of a broader registry. But getting our Department of Health to report to us on the viability of that would be helpful, and having them, required to do so.
Okay, Josh, Senator Terenzini.
Thanks, Senator Lyons. I'm just thinking through here a strategy in my own mind and listening to Senator Hardy and others here. I feel like there's something here that we can do and something that we can accomplish for these patients, because we know that what every ALS patient has in common is that they're going to die from their disease. I mean, it's one of the absolute worst diagnoses you could ever receive. I wish we had a cure in the next 5 minutes for it. But maybe it's something that we instruct our Department of Health to put up, over the next 12 to 18 months, put a plan in place to work with New Hampshire, Maine, Massachusetts, and our bordering states to come up with a regionalized registry or plan moving forward. Sounds like Massachusetts already has something, but if we could collect data from a bigger sample, and I understand 20 or 30 or 40 people in Vermont, it's tough, but I think there is, Dr. Stommel's studies in terms of some of the bacterias that we're seeing because of climate change and so on. I just think that we have an opportunity and an obligation, I would almost say, to do something to help these folks, and whether it be a regionalized registry, and we asked Mark Levine and his team to work with our neighboring states and send a report back in a year and see if there's some viable path forward.
Okay, yeah, good comments. Go ahead, Senator Hooker.
I seem to remember Dr. Levine talking about kind of bunching these neurological disorders in a registry. And that seems like a logical thing to do since, as you pointed out, Senator Hardy, our numbers are small, comparatively small. I know it's not small to somebody who's received the diagnosis, but it's something that we have to consider if the data is going to be viable. Your comments too about having physicians who diagnose alert families to the resources is really important. A lot like what we want to do with the Alzheimer's bill that we passed, so that people know where to go. And that might take a little more work of gathering those resources, gathering the information on those resources and distributing it to physicians around the state. So maybe that could be something that we ask the Department of Health to do.
Okay, Senator Cummings, any comments?
No, I
Yeah, I know this is a tough one. I think the issue for me is, what Senator Terenzini was saying about the length of life. So we identify a small number of people within a frame of a year who are going to be gone. So maybe you have 45 people who then the next 45 people, or the next year it's another set of 45 people. So there isn't a whole lot of time to get data about any individual or group of individuals for a full study. But having the numbers, having the people identified, geographic location, and as much information as one could get through a registry, I do think is important. So, I started thinking about the regional registry and thought, this absolutely is the good direction to go, because you do manifest greater numbers and you get more data. At the same time, that doesn't begin to help us look at individual patients and groupings of patients in the state of Vermont. So I'm still thinking about how we might have DOH go forward with some kind of outreach to other states, and at the same time have any diagnosis for ALS be sent into the Department of Health to keep track, and whatever data collection can go on between the time someone is diagnosed and they are no longer alive might help inform work going forward. So I haven't given up on having something in our state. Remember, the other issue around all other neurological issues is an interesting one. I know there are some reportable diseases. We probably should look at that list. It's out on the DOH webpage, and I just went through it with Rules Committee a month or so ago. But most of those neurological diseases are longer term. So there's lots of time and lots of patients, and you can do that analysis. But with ALS, they disappear quickly. So this is not easy. Senator Terenzini.
No.
I still, if I had my way, we would still, have had broad support from the Department of Health to advance the piece of legislation that was introduced the first half of the biennium, because I'm not a conspiracy theorist, but I also don't believe in coincidences. And we know from Dr. Stommel and others that there are pockets of this state that, ALS is much more prevalent than others. And to me, not being a doctor, not being a scientist, being a citizen legislator, to me, it's apparent that there is something going on in those certain areas potentially. I'm not trying to raise alarms, and I'm not trying to scare anybody, but I'm just saying, with if there's 24 cases and half of them come from one area or another, there could be reason to track that portion of our geography.
Okay. I'm going to phone a friend. Is there any friend here? Anybody want to chime in? Katie, as we're looking at the bill, Okay, Ruth, go ahead, Ruth.
Sorry, I was just trying to quickly look up the reportable diseases on the
Oh,
Department of Health
good.
website, but I didn't quite get there. But I hear you, Senator Terenzini. I do. I just think that collecting data that's not actually going to be sufficient data to lead to conclusions is going to not be helpful. So I'd rather that we come to a path where we can collect sufficient data. And I think that the diagnoses may already be reportable, but I maybe we could have Katie draft up something and have Dr. Levine back in to talk to us about it, because it seems to me that we could get to sort of an interim approach, which I know is not fast enough for people who are diagnosed right now. Nothing is fast enough, but it could be at least a start. It's taken us a long time to get where we've gotten with the Alzheimer's work. That's been years of work. So we got to start somewhere.
So I think that I wonder if the Department of Health could come in and talk with us. And if Aaron, is there a way you could reach out perhaps to David Englander and see if he's available? I'm pretty sure that there are a bunch of folks tuning in right now. And so if he's available, it might be useful to offer comment, or if he's not available, we will bring Department of Health in another time before we start making decisions. Senator Cummings.
No, I just have a hard stop. I have a 12 o'clock meeting.
Yeah,
So
ditto. Senator Terenzini, go ahead. And then Senator Hooker.
Yeah, just for clarification, we do not have to have S90 or a version of it complete by Friday. We have a few days after we get back. Okay.
Yes,
Yeah.
we have 8:30 in the morning after we get back.
And Saturday and Sundays.
Yeah. There is some time to think through this stuff. Yeah. Senator Hooker.
So I'm just looking at the list of reportable diseases on the health website, health department website, and it looks like they're contagious diseases. Maybe
that's what they usually are.
Yeah.
So I'm not looking, like I'm looking for multiple
nothing like that,
or muscular dystrophy, and I'm not seeing any of those things on here. So it's reportable diseases seem to be contagious,
which is why having a registry has been. This is not the first time this bill has been introduced. This session, it's been introduced in previous sessions, and there are a number of people, especially those who have had experience with ALS, who are very concerned about having the registry in place. And so that's where this is coming from, that kind of historical place. Go ahead.
I totally understand that, but the only disease we have a registry for right now is cancer. And that's a much more widespread disease and something that you can draw conclusions from more likely because of the numbers. They're just this. There are a lot of other really challenging and horrible and diseases, and if we're going to take the time to create a registry, it seems to me that, like, cancer is a bunch of different kinds of cancers. We could create a registry that's neurological diseases, and it would be much more potentially useful in terms of the data that we collect. And we could collect demographic data and geographic data, et cetera, on a number of diseases. And if we're going to take the time to create a registry, it seems to me, turn off the YouTube, because you can just hear what I'm saying now.
Okay, let's take advantage of having David Englander here. And David, we have a hard stop at 12 o'clock. And this is the beginning of a conversation. We're going to have Department of Health in another time to go through this. I hear that you're hearing what people are saying, and we welcome your comments from the Department of Health perspective.
actually apologize. I had to put myself on, everybody on mute, so I missed the beginning of that. So good morning.
Good morning. Just asking, you've heard what the discussion has been, and we we aren't going to make any changes that after today, but we are very much interested in hearing from the Department of Health again on this. And it's kind of we're in the rock and the hard place with a disease that kills quickly and then diseases that last longer and allow for greater research.
Sure. I think what was discussed multiple times, I think the department is more than willing to look at talking with our partners in New England and other states and trying to create, if not a regional registry, at least some kind of data sharing across the state, so we could have more robust numbers, so we'll be able to draw better conclusions, or potentially draw better conclusions. Very briefly, the reportable disease rule, it isn't just contagious diseases. There are things like Lyme and meningitis, but ALS is not there in part because of the very, very small numbers.
So then thinking about the possibility of some regional cooperation, wouldn't we want to have data up front? Wouldn't we want to begin collecting at least some minimal information about our ALS patients in Vermont?
Well, yes, more information is always better, but I think as Dr. Levine discussed, the minimal amount of information doesn't tell you enough about that person's circumstances, where they live previously, where they live now, in terms of their exposure and and work.
Right.
So ideally we'd be talking about a larger epi study where researchers and doctors would have access to longitudinal information about patients.
Right, but if you don't, I mean, so here's what I'm thinking. I get that. I understand what you're saying. But we have patients who are diagnosed and then 6 months later, they're no longer alive. And in the meantime, if there were some epidemiological survey, some information that could be included with the patient as wherever he or she lives, that would be informative, and it would be informative going forward. We don't have any of that right now.
Right.
Zero. And so taking a small step in the right direction might also help in discussing this with other states. Other states that we don't have anything, and why are you doing this without, you're trying to use our money. I'm being silly, but just some comments perhaps you could make.
And I'm happy to, well, we can, whatever the committee desires, we can certainly figure out. I think immediately, the department could come back to the committee in a matter of months with a proposal.
Months?
We could do months.
How about days? How about we're getting ready for crossover in 2 weeks.
Oh, no, I'm sorry.
I don't know what you're talking about here.
No. Let me be more precise.
Good.
I could commit the department if I could work with Katie if you wanted to say the department shall provide a report to the committee for a specific proposal. So not a proposal for proposal, but rather we could come up with a proposal for whether it be regional, whether it be national, whether it be data sharing. We could provide you something concrete. But that would take spending time reaching out to our partners. But I'm saying, but immediately the department would certainly agree to coming back to you with something in some reasonable time frame with something very specific.
Okay. All right. Thank you for that. And that we're happy to have you work with Katie. That doesn't mean it will replace the current draft, but it's certainly language that we would be interested in looking at. Senator Hardy and then Senator Terenzini.
Thank you. Thanks, David. It would be great to get to be able to see some language from y'all. The other thing I was wondering if your thoughts, or if it could be included, is we had talked about the possibility of requiring providers to provide patients with some information once they get a diagnosis of ALS. and I don't know what is already potentially required or what doctors might provide, but information on the National Registry and how to register with the National Registry and why it's important to do so. And then also information on resources in Vermont and in the region for patients who've been diagnosed with ALS, support and care resources. So if you could think about that too and what might be possible, that would be helpful.
Absolutely.
Thanks.
Okay, Senator Terenzini.
Thank you, Senator Lyons. The more I sit here and sort of stew on this, the more I'm just not crazy about the regional idea. Something is better than nothing, believe me. But I'm sitting here thinking to myself, the five of us have this huge platform that we have been honored to be elected to, right, in the Senate. And we have an opportunity to do something here to get the data and collect it that's going to affect Vermonters and the next generation of Vermonters. As much as my heart breaks for those in Maine and Massachusetts and elsewhere that suffer the disease, the five of us can influence for a better life for Vermonters, right? And I think collecting that data and having a Vermont registry is critically important because, and I'm very sensitive to this, but a lot of the diseases and sicknesses we talk about and collect about now are things that you can live with, Now it's going to affect your life and it's not going to give you the quality of life that maybe any of us would want. Like Lyme disease, for example. I feel Lyme, it's a terrible disease, but we know ALS in 12 to 24 months, you are going to succumb to the disease. And let's capture the opportunity now to try to get this registry done, in my opinion, and get this data, and let's let the scientists start to decide, hey, are there any environmental factors or anything out of the unusual about those poor people in Vermont that get this disease?
Thank you, Senator. I mean, that speaks very loudly to the bill as written with possibly some edits. So, David, you're hearing the committee speak, and I think there are concerns within the committee. All of us, we would like to see something happen ASAP. And then we also understand the need for greater data. But I think Senator Terenzini has made a very important comment. So, okay, we are at the end, and we'll stay connected on this.
Yep, I gotta go.
Yep. Okay. Thank you. We can go off YouTube